This is a wheelchair to mat transfer for an Asia A C6 patient. First, you will want to instruct the patient on the head-hips relationship, where you want the head to go over the hips in order to help create momentum. You will also want to instruct the patient on locking out the distal extremity by flicking the extremity, making sure to inform the patient to maintain their fingers in a flexed position in order to maintain tenodesis grip, as well as when the hand lands, the finger should be pointed back away from the body. When you begin the creating momentum, you want to make sure to have the patient lock out both extremities, and they can do this by flicking and flicking. And then you instruct the patient to create momentum with the head-hips relationship. So the head should be going down and away from the mat into the armpit. When the patient creates the momentum, it lifts the pelvis on the side closest to the mat. You will want to instruct your patient that when they are down, this is when they're going to push off of the extremity furthest away from the mat in order to help create the transfer. So it will go like this. Lock out, maintaining tenodesis grip. Fingers are pointed away, back and away from the body. We're going to create momentum, head over hips. And when we go down, we'll push away. And then in order to get the patient fully onto the mat, we'll perform the same thing again. But we want to make sure the arms and the legs are in the proper position to continue moving onto the mat. So you will want them to use their C6 to extend the wrist, fix the legs. They can flick out again a little further away so that we have space to move onto the mat, and then flick the wrist again so that we get good enough stability close enough to the body to give us momentum to push away. So we will again head-hips relationship to create momentum, and when we go down, we push away. To complete the transfer, making sure that the patient is safely on the mat in short sitting, we just want to make sure to have the patient flick the wrist or distal extremities again behind them so that they can hang out on their elbow joints in a safe position in short sitting.